Hey folks, it's Dr. Sam, and I'd like to welcome you to Facebook Live tonight. It's a real pleasure to be here. And I want to take a question from a patient of mine. And I don't talk a lot about contact lenses because I don't treat that many of them or measure and fit as many contact lenses as I used to. But this is a patient, Rose, and she's asking a question about her history of wearing contact lenses. And her question is, see if I can get it up here, that for the past 20 years, I've tried contacts, and I was told that because I have oily tear ducts, there's a film that forms on my eyes, on my lenses, after about 3 hours of wear. What is your opinion in terms of wearing contact lenses? Well, this is a great question because, today what we're really dealing with a lot of is the health and production of our tears. And we either produce too many tears or we don't produce enough tears. And of course, there are different components to the tears as well. We actually have an oily part of the tears, and then we have a more watery part of the tears. And if somebody is either producing, we'll start with producing too much of the oily tears, what that's going to do is that's going to clog up the tear ducts. Now, what's behind that could be a chronic low-grade inflammation that is occurring around the eyelids and the eyelashes, and this is going to cause the tears not to cover the cornea very well. And so if you start wearing contact lenses, which can create a little bit of an irritation, then what happens is a person either gets a cloudiness in the contacts or they just can't wear them at all. So what I would say, Rose, is that I would seek out a contact lens specialist who can try on different daily wear disposable contacts. For some people, they do better with a higher water content. So let's talk about that for a minute. So in soft contacts, you can get anywhere between about 35 to 38% water content of the soft lens, all the way up to 70% water content. And especially in New Mexico, which is where you live, but also in other places where there's a dry, it's more dry, using a higher water content lens sometimes can be a good answer. However, there's a limitation on how long you can wear the contacts. And so if you try on different daily wear disposable contacts, that would be my recommendation. And to find a brand that you can wear 3 to 4 hours, say if you're skiing or you're out rafting or hiking. And also you can use Similasan or Optique homeopathic eye drops if they start getting dry. But probably you're never going to be able to wear full-time contacts because of the imbalance in your tear production. Now, another thing that you can do, and this works for a lot of people who have what we call meibomian gland dysfunction, where there's an irritation in the production of the tears along the eyelashes, is you can start treating yourself with eye bright compresses. Eye bright tea that you brew up, then you let it cool and you put the compress over your eyes. You can do warm and cool compresses. Sometimes that can help reduce some of the inflammation in the tear production mechanism, and then you might be able to wear the contacts a little longer. But I would seek out a contact lens specialist, and the only way you'll know for sure is to try on different contacts and then choose one to experiment with. I like the daily wear disposables because they don't cost you very much, and if one brand doesn't work, you can go to another brand.